There have been criminal prosecutions for recklessly transmitting HIV. That's when you know you have HIV, you have unprotected sex with a partner who doesn't know your status, and that partner gets HIV as a result. In fact, this is part of a global trend to criminalise much of HIV transmission. It's not just in the UK, and NAT has been at the forefront of thinking about how to respond. NAT, along with other HIV charities in the UK and indeed the United Nations, doesn't think this process is a very good idea or very helpful. For one thing, we don't think it reduces the behaviour that we're worried about. Yes, we need to do something about it, but is criminalisation the right answer? Why don't people talk about HIV with sexual partners? It's mainly because of stigma. It's because of fear of rejection. And criminal prosecutions and the associated media frenzy tend to increase stigma rather than decrease it, and probably thus encourage more of this kind of reckless behaviour rather than result in its reduction. And of course, people with HIV become very nervous about talking about the difficulties they're having in unsafe sex with their doctors and with health advisors because of the fear that they might be reported on in some way. So again, in getting the support they need to be better at safer sex, they are left without help. It seems very much like an own goal. Whilst NAT is opposed to the prosecutions in principle, while the law remains the law, we want to make sure in the UK that people with HIV are not harmed by it or are harmed as little as possible. So we've worked with the Crown Prosecution Service to produce prosecution guidance. The guidance makes clear to people with HIV what the law says, so they're not confused or worried unnecessarily. It also makes clear to prosecutors how hard it is to prove that someone was responsible for somebody else's infection and the limitations on the scientific evidence that's sometimes used in these trials. We've also worked with the police, with the Association of Chief Police Officers, to get investigation guidance so that police investigate fairly, they respect confidentiality, they understand how HIV is and is not transmitted, for example. There are still too many unfounded and ill-informed police investigations, so now we have the guidance. We need to do more to promote it and to disseminate it, and we're working on that at the moment. We've worked on this issue with many other organisations, Terence Higgins Trust and the HIV Doctors Association, BEVA, for example. And we're now active in Scotland to try and secure similar prosecution and investigation guidance there. We remain convinced that there are far better ways to reduce HIV transmission and encourage people to disclose their status than the criminal law. But while the law exists, we're working to ensure best practice across the whole of the criminal justice system so that the rights of people with HIV are respected and protected.